1. May help combat oxidative stress by improving the antioxidant system. According to a systematic review and meta-analysis of 9 controlled clinical trials with 415 subjects published in the International Journal of Clinical Practice in 2021, even though no significant impact was observed on glutathione peroxidase, spirulina had a marginal significant effect on total antioxidant capacity and superoxide dismutase activity, indicating its potential to bolster the body's ability to counteract oxidative stress. 2. May help with hypertension. In a systematic review and meta-analysis of 5 randomized controlled trials with 230 subjects published in August 2021, it showed that spirulina supplementation led to a significant decrease in systolic and diastolic blood pressure. This effect was more pronounced in the participants with high blood pressure. According to the authors, spirulina administration might have a supportive effect on the prevention and treatment of hypertension. However, more exact randomized controlled trials are needed to clarify the effect of spirulina supplementation on blood pressure. And in a randomized, triple-blind, placebo-controlled clinical trial published in September 2021, researchers looked at whether adding spirulina to salad dressing could help people with high blood pressure. 41 subjects with hypertension completed the study. They either had salad dressing with 2 grams of spirulina powder or a placebo for 2 months. Results showed that those who had the spirulina dressing saw significant decreases in systolic and diastolic blood pressure, as well as lower triglyceride, total cholesterol, and bad cholesterol levels. No significant changes were noted in the placebo group. 3. May help with managing blood sugar and cholesterol. A 2015 systematic review and meta-analysis of 7 randomized controlled trials showed that spirulina supplementation significantly raised good cholesterol and lowered total cholesterol, bad cholesterol, and triglycerides. Also, in a systematic review and meta-analysis of randomized controlled trials published in 2019, researchers evaluated the effects of spirulina on glycemic control and serum lipoproteins in patients with metabolic syndrome and related disorders. The data revealed that spirulina administration significantly reduced fasting blood sugar, insulin levels, total cholesterol, bad cholesterol, and very low-density lipoprotein cholesterol, while increasing good cholesterol. 4. May help with weight management. According to a systematic review and meta-analysis of 5 randomized clinical trials published in December 2019, even though no significant impact was observed on body mass index and waist-to-hip ratio, spirulina supplementation reduced body weight, body fat, and waist circumference, especially in the obese participants. While the findings are promising, more comprehensive studies with consistent methodologies and larger participant groups would strengthen the evidence.
By the way, before I continue, if you're new here, I'm Jera from the Philippines.
Welcome to my channel where I share my knowledge and discoveries about everything related to natural health remedies and personal development gained from reading scientific journals and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing. Also, you may want to check out my ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on, 5. May have potential use in preventing and managing anemia. In a study titled The Effectiveness of Spirulina Compared with Iron Supplement on Anemia Among Pregnant Women in Indonesia, 60 pregnant women were divided into 2 groups. 30 women took spirulina and the other 30 took the usual iron supplement. Before the study, the average hemoglobin level was 10.16. After 8 weeks, those who took spirulina saw a significant increase to 13.35, but those on the iron supplement didn't show a significant improvement. And in a randomized controlled trial published in 2021, 240 children with iron deficiency anemia were randomly assigned to 3 groups. One got spirulina corn soy blend, another got a regular corn soy blend, and the third got a placebo. The kids had to drink porridge made from 1.7 kilograms of the given powder 3 times a day for 6 months. The kids who had spirulina porridge had a significantly higher chance of recovering from anemia compared to those with regular porridge or placebo. The recovery time for the spirulina group was much shorter, 8 days compared to 19 days for the regular porridge group and 33 days for the placebo group. According to the study authors, the speed and number of recoveries were even better than what the World Health Organization considers as the minimum standards for food interventions. This suggests that combining spirulina with the usual food can be an effective strategy for addressing iron deficiency anemia. 6. May help with dehydrated, oily skin and improve skin elasticity. In a 2015 clinical study published in Clinical Pharmacology and Biopharmaceutics, 40 healthy female volunteers were divided into 2 groups, young, 18 to 39, and mature, 40 to 65. Each group was randomly assigned to apply either a gel cream with spirulina extract or a gel cream without spirulina extract to their faces twice daily for 28 days. The results showed that the gel cream with spirulina extract increased skin water content and reduced water loss in both groups. The mature group showed a significant reduction in water loss compared to the younger group. group, and only the gel cream with spirulina extract reduced skin oil content. Additionally, the texture and overall appearance and uniformity of the skin got better. Moreover, according to a single-blind study on 44 healthy individuals aged 30 to 50 years published in the European Journal of Pharmaceutical Sciences in 2017, using sunscreen with spirulina and dimethylmethoxychromanol-loaded solid lipid nanoparticles significantly improved the skin pigmentation, the collagen degradation on the dermis, and thereby the skin net elasticity after 84 days of application compared to the sunscreen alone. The sunscreens were well tolerated and did not cause any noticeable irritation to the skin. 7. May help treat allergic rhinitis. According to a double-blind, placebo-controlled study published in the European Archives of Otorhinolaryngology in 2008, spirulina consumption significantly improved the symptoms and physical findings compared with placebo, including nasal discharge, sneezing, nasal congestion, and itching. Spirulina is clinically effective on allergic rhinitis when compared with placebo. However, further studies should be performed in order to clarify the mechanism of this effect. And in a randomized controlled clinical trial published in 2020, researchers compared spirulina and cetirizine for treating allergic rhinitis in 53 participants. The experimental group took 2 grams of spirulina daily, while the control group took 10 milligrams of cetirizine daily for 2 months. Symptoms and inflammatory markers were assessed before and after treatment. The experimental group showed significant improvement in symptoms like runny nose, nasal blockage, and smell reduction. Sleep, daily activities, and social engagement also improved significantly in the experimental group. Inflammatory markers were more favorable in the experimental group after 1 month of treatment. Spirulina proved more effective than cetirizine for allergic rhinitis symptoms and could be considered as an alternative treatment. 8. May have potential use in preventing oral cancer. In a 1995 study published online in 2009, researchers tested spirulina if it could reverse oral leukoplakia in people who chew tobacco. 44 participants took 1 gram of spirulina daily for a year, while 43 took a placebo. Results showed complete regression of lesions in 45% of the spirulina group compared to 7% in the placebo group. The response was better for certain types of lesions. However, 45% of those who improved with spirulina had recurrent lesions within a year of stopping the supplement. Spirulina didn't cause vitamin A toxicity. This is the first study of its kind, but more research in different settings and populations is needed. 9. May help treat chronic arsenic poisoning. In a randomized placebo-controlled study published in Clinical Toxicology in 2008, 41 patients were randomly assigned either a placebo or spirulina extract, 250 milligrams, plus zinc, 2 milligrams, twice daily for 16 weeks. Spirulina extract plus zinc significantly reduced arsenic in urine and hair. It removed 47.1% of arsenic from hair. No major side effects were observed. The treatment improved skin conditions, melanosis and keratosis, compared to the placebo. According to the study, authors spirulina and zinc may be useful for the treatment of chronic arsenic poisoning with melanosis and keratosis. 10. May help improve the health-related quality of life of people with non-alcoholic fatty liver disease. In a 2014 prospective pilot study published in the Annals of Gastroenterology, 15 Cretan patients with non-alcoholic fatty liver disease took 6 grams of spirulina daily for 6 months. After the intervention, liver-related markers like aspartate aminotransferase and alanine aminotransferase significantly decreased, while good cholesterol and hemoglobin increased. Weight and insulin resistance also decreased, improving their quality of life. However, no changes were observed in sonographic findings. The researchers concluded that spirulina supplementation at a high dosage of 6 grams daily in non-alcoholic fatty liver disease patients has strong and multiple beneficial metabolic effects and improves their health-related quality of life. While further studies are clearly needed, these preliminary findings are promising. 11. May have a positive impact on exercise-related physiological responses. In a randomized trial published in the European Journal of Applied Physiology in 2020, 11 untrained males took either spirulina or a placebo for 7 days. They performed arm cycling exercises before and after the supplementation. The results showed that spirulina significantly increased hemoglobin levels compared to the placebo. During the exercise sessions, those who took spirulina had lower oxygen uptake and heart rate, suggesting improved efficiency. Spirulina also increased oxygen uptake during a fatigue test. However, the time to fatigue didn't differ between spirulina and the placebo. Despite these results, more large-scale human trials are needed on the subject. While rare, severe side effects from spirulina can include allergic reactions such as anaphylaxis and throat swelling. If this happens, stop using spirulina and consult your healthcare provider. Individuals with phenylketonuria or other amino acid disorders may need to avoid spirulina due to its high protein content. The safety of spirulina during pregnancy or nursing is uncertain, so consult with a healthcare provider. Don't give spirulina supplements to children without consulting their pediatrician. If you take medication, especially for autoimmune diseases, blood pressure, or cholesterol, consult your doctor before using spirulina, as it may interact with certain drugs and health conditions.
If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching!